Hello, welcome to PG Pathshala. The course is Biophysics, paper 8, Medical Physics, module number 7, that is the cardiac pacemakers. I am Dr. Atanu Roy, Senior Resident, Department of Physiology, All India Institute of Medical Sciences, New Delhi. I will be talking about this module on behalf of Dr. Bhavna Mato. In this module, we will be talking about the cardiac pacemakers. So, the learning objectives of this module is to define a pacemaker. Then we will read about to understand the physiology behind normal rhythm of heart, to know the indications of using artificial pacemakers, to know the components of artificial pacemakers, to understand the functioning of artificial pacemakers, and finally we will be doing an overview. The overview of this module consists of introduction, physiology of pacemaker of heart, indications for artificial pacemakers, types of permanent pacemakers, components of a cardiac pacemaker, functioning of the pacemaker system, and also the lifespan of pacemaker and pacing threshold, the common pacing problems and the other pacemaker like devices, and finally we will conclude this module with summary. Let's come to introduction. The human heart beats rhythmically at a rate between 60 to 100 beats per minute. Ever wondered what decides the rate at which our heart keeps beating? It is the sinoatrial node of the heart where there are cells which generates these impulses. As they set the pace for beating of heart, they are appropriately called the cardiac pacemaker cells, because they directly control the heart rate. They make up the cardiac pacemaker, that is the natural pacemaker of the heart. Sometimes when there is a failure of natural pacemaker of the heart, or there is a block in the conduction system which does not allow the impulse to conduct, there is a need for an artificial pacemaker. An artificial pacemaker is a device which uses electronic impulses delivered by the electrodes to the heart muscles, and therefore it regulates the beating of the heart. The chief purpose of an artificial cardiac pacemaker is to maintain a suitable heart rate. The new generation pacemakers generally also have several functions besides this. The most elementary one monitors the heart's inherent electrical rhythm, and whenever there is a failure to detect a heartbeat within a stipulated time, the pacemaker stimulates the ventricle of the heart with a slow voltage pulse. Both sensing and stimulating takes place on a beat-to-beat basis. The more complex ones includes the ability to sense or stimulate both the atrial and ventricular chambers. Let's discuss the physiology of pacemaker of heart. The figure 1 that you can see in the write-up and also in the slide is a simplified diagram of the conducting pathways of the heart. There are two properties of the SN node cells which make them appropriate to be the pacemaker of the heart. One, automaticity. Second, rhythmicity. Automaticity is the property of a tissue to generate impulses spontaneously, while rhythmicity means that the impulse is generated at regular intervals. Then let us think about the conducting system of the heart. The conduction of the cardiac impulses begin at the SN node lying in the superior posterolateral wall of the right atrium, from where it conducts to atrioventricular node and finally spreads to the ventricular musculature. The rate at which different parts of the conducting system discharge impulses is different. The fastest impulse generator is the SA node, followed by the AV node. Being the fastest, it is the rate at which SA node fires which decides the rate or pace of the heart. This is so because an impulse originating in the SA node conducts through the conducting system and causes serial contractions of different chambers of the heart. The conducting system of the heart consists of specialized fibers of the muscle that present as the synovial node. They also run along the internodal pathway, which are known as the internodal tracts, then the atrioventricular node, the bundle of His and its right and left terminal branches, and finally it terminates with the Purkinje fibers. Before an impulse from the AV node or any other part of the conducting system can initiate an impulse, the next impulse from the SA node is discharged because its rate of firing is the highest. The electrical activity of the nodal tissue is unique as it does not have a constant resting membrane potential, which is the difference in the electrical potential across the cell membrane seen at rest. Although the tissue is at rest, this potential in the nodal tissue moves towards depolarization, and once the threshold is achieved, an impulse called the action potential is fired. After firing of this impulse, the potential comes back to the resting levels. This instability of the resting membrane potential in the cardiac tissues generate its automaticity, and the repetition of this cycle causes its rhythmicity. For the SA node, this rate is around 70 beats per minute. The slow depolarization or rise of the potential during the resting phase is called as the pacemaker potential, which is shown in figure number 2. The figure number 2 depicts the rhythmic electrical activity in the SA node. Let us discuss about the ionic basis of pacemaker potential. There are various important things, but we must know the leakiness of the cell membrane. The cell membrane of the nodal tissue is relatively leaky or permeable to ions at all the times. Its maximum leakiness is to sodium channels or sodium ions. It is the inward leak of sodium ions inwards that cause depolarization. Then it also consists of the funny current. It is generated by both sodium and potassium movement and is mainly responsible for the generation of pacemaker potential. It has a threshold of -40 to -50 millivolts and becomes more as polarization increases. We should also not forget the contribution of calcium. The calcium ions also contribute to the pacemaker potential. Inward flow of calcium increases the depolarization, making it reach the threshold faster. Disorders of the conducting system. Under physiological conditions, the conducting system of the heart allows an impulse generated by depolarization of SA node, which propagate through the heart, causing rhythmic beating. The electrical conduction of the impulse causes the mechanical beating of the heart. There are two main disorders of the conducting system which can adversely impact the heart's electrical rhythm. One, bradycardia, when the heart beats too slowly and the patient will present with symptoms of fatigue. dizziness, fainting, and lethargy. Tachycardia is also an important factor that we must learn. In tachycardia, when the heart beats too fast and the patient presents with palpitations or racing heart and pounding in the chest. Both these disorders are due to three main reasons. First, SNO disorders where the SNO fails to generate electrical impulses properly. This causes the patient's heart to beat slowly. Second, there are various grades of heart block in which the conducting pathway is the heart. Second, there are various grades of heart block in which the conducting pathway of the heart is defective at the AV node. Here, the SA node is functioning correctly, but the impulse doesn't get relayed from the AV node. As a result, there is bradycardia. The heart's pumping becomes inefficient and the patients feel easily tired, out of breath, dizzy, and uncomfortable. In the third situation, there are aberrant conduction pathways causing the impulse to circle back into the conducting pathways, stimulating the same cardiac cells repeatedly, instead of progressing through the heart and dissipating. This re-entry loop allows one signal to cause the heart keep beating faster, which causes tachycardia. Now let's discuss the indications for artificial pacemakers. Cardiac pacemakers are implanted most commonly in patients who have a heart rate slower than usual, that is called as the bradycardia. But more important than bradycardia are the symptoms that may arise because of it, irrespective of whether the bradycardia has been documented or not. Pacing can be done to prevent symptomatic bradycardia in asymptomatic patients if the risk for rapid development to serious symptoms are there. Let's discuss the different types of permanent pacemakers. One is the single channel pacemaker, where one pacing lead is placed into a chamber of the heart, either the atrium or the ventricle. The second type is dual chamber pacemaker. Here the leads are placed in two chambers of the heart. One lead paces the atrium and one paces the ventricle. This type more commonly resembles the natural pacing of the heart by assisting in heart in coordinating the function between the atria and ventricles. Then let's discuss the rate responsive pacemaker. Here the changes in the patient's physical activity are detected and pacing rate automatically adjusted to fulfill the body's need. The components of a cardiac pacemaker have three important parts. One, the pulse generator, which is an implantable device. Second, lead that connect this pacemaker system to the heart. Third, a computer programmer to communicate with the implanted device. Pacemaker system is the impulse generator and therefore it is often referred to as the pacemaker, but it is a requirement that all the three components work in synchrony for successful pacing. Functioning of the pacemaker system. The essential requirement from a pacemaking machine is that it delivers precisely timed small output electrical pulses. Hence, there are two vital things which this device requires. First, it is the requirement of a winner, and second, it is the power source for delivering the impulses. Besides this, the present generation of pacemakers also contains a complex circuitry which can sense the incoming information and then respond by giving them pulses appropriately. Some of the newer devices contain memory and can store electrocardiograms which can be downloaded in the clinician. Simplified circuit diagram of a pacemaker is simply shown in figure number 3. Now, when the pacemakers are beating, this means they also have a timing mechanism. The pacemaker receives inputs from the lead implanted in the heart and functioning as a sensor. This sensor senses the electrical activity of the heart and enables the device to pace according to the requirement of the heart. A problem with the sensing of electrical activity is that the body essentially creates a lot of electricity, and it commonly seen that the activity of the ventricles generally drowns the signal generated by the smaller atria. A way to removing this ventricle noise is to filter the signal. Filtering enables us to find the signal of choice from the electrical activity. The clinician adjusts these filter settings, making the device less or more sensitive, although the final signal that we get may be weak, and hence a sense amplifier is installed to boost the signal, making it large enough for the device to work with. A comparator compares the filtered and the amplified signal to the baseline, after which the signal enters the logic community. Let's discuss this energy source. The second requirement is of an energy source. For this, a battery in a titanium case is present in every pacemaker and takes up almost 50% of the space. Pacemakers usually require around 2.8 volts, but since pacemaker must deliver greater than this, we depend on voltage amplifier, which is the circuit used to increase the volatile or the voltage output to increase the delivered voltage. This amplifier will store the energy till the amount available is appropriate for delivering the pulse. These days, lithium iodide battery is used, and many of the pacemakers also report the battery status on the programmer. One of the greatest definitions of a lithium iodide battery is that its lifespan is predictable. Therefore, the course of replacement is easily predictable. Now discuss the lifespan of pacemakers and threshing and pacing threshold. The actual lifespan of a pulse generator will depend not only on the battery but its usage too. Every battery will require some level of housekeeping, current, and even if the pulses or even if any pulse, eventually its battery will wear out. The most important factor deciding device longevity is the output pulse. The two variables which are modifiable are the pulse amplitude and the measurement in milliseconds. The pacing threshold is the lowest amount of energy that is required to consistently cause repolarization of the heart. Representation of this is the strength duration curve in figure number 4, with Rio base defining the minimum voltage needed to capture the heart and Chronox 2 times Rio base voltage extended to meet the curve. As a reasonable safety margin, the safety margin is amount added to the pacing threshold for promoting a pacemaker output to assure that the pacemaker will capture the heart. Even if the pacemaker threshold changes, as a rule, the cardiologist determines the pacing threshold and not doubles of it. The figure number 4 shows the strength duration curve, depicting the amount of energy it takes to capture the heart. Rho base is the point at which the plateau begins and roughly resembles the minimum voltage requirement to capture the heart. The positive at which twice the Rho voltage means the curve is defined as chronaxe. The most important common pacing problem can have been classified by 1. The failure to capture where the pacing output is low. 2. Failure to pace may be due to overseeing or oversensing of psychotic and non-psychotic signals. Pacing at a rate inconsistent with the programmed rate due to problem with the sensing. Resembling pacemakers are other devices called implantable cardioverter defibrillators. These devices can be life-saving for patients at risk for sudden cardiac death. An ICD has the ability to treat many types of heart rhythm disturbances. Now we have reached the end of module and we will end with the summary. The heart beats rhythmically by impulses initiated by the sinoatrial node. An artificial pacemaker is a device which uses electrical impulses delivered by electrodes to the heart muscle and therefore regulates the beating of the heart. Third, the automaticity is the property of a tissue to generate impulses simultaneously or spontaneously. Besides this, these tissues also generate pulses at regular intervals, a property known as rhythmicity. The inability of the resting membrane potential in the cardiac tissue generates is automaticity, and the repetition of this cycle causes its rhythm. Ionic basis of pacemaker potential is due to leakiness of the cell membrane, funny currents and calcium ions. For the SA node, this rate is around 70 beats per minute. The slow depolarization or rise of potential during the resting phase is called pacemaker potential. The cardiac pacemakers are implanted most commonly in patients who have a heartbeat slower than the usual or bradycardia. The permanent pacemakers are of 3 types: single chamber pacemaker, dual chamber pacemaker or rate responsive pacemaker. The pacemaker system consists of 2 components: pulse generator, which is an implantable device that connect this pacemaker system to the heart, and a computer program to communicate with the implant. The next essential requirement for pacemaking device is that it delivers precisely timed small output electrical pulses. Hence, there are 2 essential things which device requires. First is the requirement of a timer. Second